Please note that the information within this video series on the Mental Health and Wellbeing Act 2022 is not legal advice. We'd also like to let you know that the content in these videos has been checked and approved by the Victorian Department of Health's Legislation and Entities Oversight Team. Hi, and welcome to the fourth video in Tandem's video series about the Mental Health and Wellbeing Act 2022. Video 4 is about supported decision-making, including the various tools or mechanisms that help people to participate in decision-making. It's also about the roles that family, carers and supporters can have in relation to supported decision-making. And at the end of the video, I mention where you can find further information on the various topics in all 4 of the videos in this Tandem video series about the Act. Supported decision-making is about helping a person to communicate their views and preferences and be involved in decision-making, such as about their treatment. A person's decision-making can be supported in a number of different ways, which we'll talk about shortly. The 2022 Act's supported decision-making principle states supported decision-making practices are to be promoted. Persons receiving mental health and wellbeing services are to be supported to make decisions and be involved in decisions about their assessment, treatment and recovery, including when they are receiving compulsory treatment. The views and preferences of the person receiving mental health and wellbeing services are to be given priority. Supported decision-making can mean that even when a person is receiving compulsory treatment, they should still be involved in decisions about their care, treatment and support, which may in turn minimise the restriction of their rights. Supported decision-making is in contrast to substituted decision-making, which is when someone else, such as a clinician, makes decisions on a consumer's behalf. As we can see here from the principle, the 2022 Act aims to have supported decision-making happen more often. 2022 Act describes various tools or mechanisms to help people express their views and preferences and to participate in decision-making. As you can see here on the slide, these are nominated support persons, advanced statements of preferences, and the opt-out non-legal advocacy service. I'll go into each of these in more detail shortly. Supported decision-making tools can help family, carers and supporters to advocate for and assist the people they support. I'll first talk about nominated support persons. The term itself has changed with the 2022 Act. It was just nominated persons in the 2014 Act. So who is a nominated support person exactly? This is someone that a person has appointed to advocate for them and support them in the event they receive compulsory assessment or treatment. The nominated support person is often a family member, carer or supporter. The role of a nominated support person only takes effect or becomes active, in other words, when the person who has appointed them is placed on a compulsory assessment or treatment order. Under the 2022 Act, the role of the nominated support person is to advocate for the views and preferences expressed by the patient, including preferences provided in the advanced statement of preferences, if there is one. This is a change from the 2014 Act, which focused on supporting and representing the person's interests. There's an important distinction here, which I'll go into more in a moment. The role also includes helping the person to understand information and decisions, to communicate their views and preferences, to make and participate in decisions, and to exercise the rights they have under the Act. The 2022 Act has more emphasis upon service providers assisting nominated support persons to perform their role, which is very positive. This includes services being required to take all reasonable steps to find out if a patient has a nominated support person as soon as practicable after the service becomes responsible for a patient's assessment or treatment. The Act also requires services to keep the nominated support person informed about the treatment of the person they support. So, the service must take all reasonable steps to support the nominated support person to perform their role. This can include allowing the nominated support person to view documents related to the person's treatment and service provision, including the treatment plan and the advanced statement of preferences, if one exists and the service has access to it. This can also include giving the nominated support person reasonable opportunities to attend any meetings between the patient and the treating team. The Act also has several provisions that require the mental health service provider to inform the nominated support person about certain decisions and events and consult with the nominated support person about certain decisions and events. The full list of the events that a nominated support person should be informed of or consulted about can be found in the Department of Health's online handbook on the Act, and there's a link to that in the slide. If the person you support is keen for you to be their nominated support person and you wish to do so, it's a good idea to have a discussion as part of the nomination being made about how they would like you to advocate for and support them. To be valid, an appointment of a nominated support person must be in writing and satisfy certain criteria. There's an online template, but it can also be handwritten. A change from the 2014 Act is that an appointment required an authorised witness. However, under the 2022 Act, any adults can be a witness. This change was made because very few people had a nominated support person, and it's hoped this will help more people to have it in place. You can find information on all the ins and outs of this, including how someone can resign from the role or a nomination can be revoked, in the Department of Health's handbook on the Act. The handbook also includes a link to the online template for the appointment form. It's important to acknowledge that some nominated support persons may experience a situation where they are concerned that the current views and preferences of the person they support would be harmful. There may be a conflict between the views of the nominated support person as a family member, carer, or supporter, and the current views of the person who nominated them, particularly when they're acutely unwell. In these situations, nominated support people can still express their own views and concerns as a family member, carer, or supporter to the service if the nominated support person makes it clear that these are their own views or concerns and does not represent the views and preferences of the person who nominated them. So, it's important that services know when nominated support persons are expressing their own views and concerns and when they are speaking on behalf of the person they support. Moving on to advanced statements of preferences. These were known as advanced statements under the 2014 Act. An advanced statement of preferences is a document that sets out a person's preferences in relation to their treatment, care, and support in the event they receive compulsory assessment or treatment in future. It helps the person communicate what is important to them and for this to be considered by their treating team. And it can help family, carers, and supporters to advocate to the treating team for what is important to the person. Under the 2022 Act, a broader range of preferences can be included. In addition to information such as treatment that the person has found effective or ineffective, and who they'd like the health information to be given to, it can now cover any aspect of care and support. This might include, for example, considerations about physical health, managing finances, and caring responsibilities such as for children and pets. Mental health services are now required to take all reasonable steps to find out if an advance statement of preferences has been made by the person they are providing compulsory assessment or compulsory treatment for. And if one is available, the service must make all reasonable efforts to follow it. A psychiatrist can only make a treatment decision that does not align with an advance statement of preferences if they are satisfied that the patient's preferred treatment is not clinically appropriate, or the patient's preferred treatment is unable to be provided by the service, despite all reasonable efforts being made to provide that preferred treatment. Another important change is that if a treatment preference in an advance statement is overridden, then the reasons why must be given to the consumer and the nominated support person, if there is one, in writing within 10 business days. In the previous Act, written reasons only needed to be given if requested. As with the nominated support persons, an advance statement of preferences needs to be in writing and satisfy certain criteria in order to be valid. There's an online template, but it can also be handwritten. You also don't need an authorised witness anymore. Any adults can be a witness. This is also to encourage uptake. More information on advance statements of preferences, as well as the template for making one, can be found in the Department of Health's online handbook on the Act, and we have a link to that in the slide there. If they wish to, a person can ask their nominated support person, a family member, carer, or supporter, with assistance to make an advance statement of preferences, and it's ideal as well for one or more of these people to have a copy. And lastly, non-legal mental health advocacy. Under the 2022 Act, non-legal advocacy is now an opt-out rather than opt-in service. This is a big change, and at Tandem we think it's a very positive one. Under the 2014 Act, people had to contact the non-legal advocacy service if they wanted that kind of support. However, many people weren't made aware that this service existed. So, just to first provide a quick definition of non-legal advocacy. It's a service that supports people receiving compulsory assessment and treatment, or who are at risk of receiving compulsory treatment, to understand and exercise their rights, express their views and preferences, and engage in decision-making about their treatment, care, and support. The opt-out arrangement means that when someone is placed on a treatment order, or when a mental health tribunal hearing is scheduled, or when certain other events occur, a notification is automatically sent by the mental health service to the advocacy service. The advocacy service then contacts the consumer to ask if they would like their support, and consumers then choose whether to have the service, so they can opt out if they don't want it. It's hoped that the service being opt-out will increase access to it. People can also ask to be removed from the notification register if they do not wish to be contacted by the advocacy service in future, and can also ask later to be put back on it at any time. Independent Mental Health Advocacy, IMA is the acronym, provides this service. However, someone can choose to be supported instead by VMIAC, the Victorian peak body for mental health consumers, if they would prefer. IMA is free, confidential, and independent of mental health services. IMA can support anyone who is receiving or is at risk of receiving compulsory treatment. IMA can be contacted directly. People don't need to wait until IMA receive an automatic notification. A family member, carer, or supporter can also contact IMA on the person's behalf. IMA's phone number is 1300 947 820. I wanted to mention also that IMA can help people make an advance statement of preferences, appoint a nominated support person, seek a second psychiatric opinion, seek legal advice, apply to the Mental Health Tribunal, understand and access the mental health and wellbeing service system, and make a complaint. IMA is not funded to provide advocacy directly to family, carers, and supporters. The 2022 Act states, however, that a consumer can request a mental health advocate, i.e., IMA, to advocate for the rights of a family member, carer, or supporter if those rights relate to the treatment, care, support, or recovery of the consumer. IMA can also refer family, carers, and supporters to other services that are able to provide you with advocacy and other kinds of support. This might include, for example, Tandem Support and Referral Line, which can be contacted on 1800 314 325. And before we wrap up, I'd like to mention where to find more information on the Act, including on all the topics I've discussed in these videos. Here on the slide, we have the addresses for Tandem's webpage about the Act. This includes a copy of the slide deck from this and the other 3 videos, from which you can click on these links. The links we have here include to the full text of the Act itself, and also where to find all the information resources the Department of Health has. The Tandem webpage and the Department's webpage have many different links to other websites that have useful resources too. And that brings us to the end of the Tandem video series about the Mental Health and Wellbeing Act. For more information about Tandem, including opportunities to participate in system reform, please visit our website, tandemcarers.org.au. Thank you for watching, and we hope you found it useful.